Trying to find the best way to say what it is I'm thinking and feeling, and I'm not quite sure. On one hand, I appreciate your willingness to put it out there and talk about what's going on with you in terms of hopes and expectations and even desires. It's kind of a jumble of feelings. I'm not sure how to sort them out in a way that's intelligible. I'm concerned about expressing what I'm thinking or feeling in a way that is minimally hurtful or invasive, okay, if in fact they are. There's a part of me that's hearing that the ante is going up, in that, and I'm wondering why am I perceiving it that way, and if in fact that's accurate. Because there's a part of me that says, okay, I concur with what seems to be the perception that people are putting out their stuff in different ways. And so I'm wondering what's going on with you, and you've talked about a little bit that the desire, well, it's almost like I feel like I'm hearing, if it goes beyond a certain point, I want out. And so unless it's done this way, or it follows this, it conforms to this general whatever, is that accurate, or am I off base there?
Last week, you've experienced me as controlling, and I hear you saying that again. And that was something I really had to look at. I had to say, am I doing that? That's a real question for me that you're bringing up. And what I'm saying today is that that kind of was what I was doing when I said I'm going to leave the group. It was like, this is not a therapy group. It's not a group where other people are exposing their wounds in the way that I was exposing my wound. And I've done it, and if I'm the only one that's going to do it, I don't want it to be on the videotape, and I don't want to, be that person in this group. And so what I'm saying is, I'm not going to be that person in this group. I'm not trying to control the group. I'm shifting my perspective.
Me, still trying to sort it out. I think part of where I was coming from on that was it had been brought up that you'd expressed a desire something when you signed the waiver, that you had the ability to edit.
Yeah.
And I wasn't even aware that that was an option, and it felt. I don't know, there was something that just kind of stuck with me, and it didn't feel right to me, but that's my stuff again. I too am learning how to be. I too am not quite sure. I am experimenting, I am trying, I am putting out, I am seeing what's happening, and sometimes I want to pull it in, and other times okay, all right, it's safe, it isn't. So, in part, when I hear you talking about this one is, well, I'm not going to be this way, or I'm going to focus on doing this, I can really understand that. Because for me, in my experience, where I'm at is, what's going on here? I am learning. Truly, I am learning. As I drove home last time, I found myself wondering about a lot of things, about what was it in my stuff that had brought me to that point. And I do have a lot of issues around being recognized for who and what I am, as opposed to expectations for what I should be or ought to be. And whenever I hear anything like that, I tend to go into a defensive space. And there's another part of me that says, conditional things like I want you to be a certain way, or I want to experience it a certain way. There are flags that go up in my being that I'm trying to say, what's that about? In terms of the noticing particulars about facial expressions, I would have to say that I don't have a mirror here except in a larger sense of the group, metaphorically, but I can't see how I am looking. So I am looking very closely and intently at other people. And I was as much sharing an observation. It wasn't meant as a criticism, but it may have come across that way. It was just an observation of, for me, what I experience and what I perceive. Oh, it seems to be there's more animation in one context, another way it seems to be less so. And is that valid? Is that what you're experiencing, and so forth? Truly, when I left this group last week, it was with the resolve to do no harm. It is truly to do no harm, and I was concerned that I had. All right, and
John, can I interrupt you
Sure.
for a minute and give Judy a chance to respond, because she seems to be getting a little
Please.
upset. Take your time. Is that okay?
Sure.
Thanks.
Take your time. The cameras are rolling, but we're all here.
Oh, here's what it is. You handed me the knife, and I did like that with it. You know, and the knife was, your face looks controlled. And to me, being my age especially, I have a lot of issues about my face. Oh, thank you. And I've seen myself on video before, and sometimes, and when people take pictures of me, when somebody aims a camera at me, I can't stand the way I look. My face does feel like a mask. And I know that, you know, if somebody aims a camera at me and I don't know, and I'm participating, then I'm very photogenic and I look wonderful. And so, you know, what I heard was that I'm looking the way that I hate the way that I look. And that my face does feel like a mask sometimes. And that's not how I want to look and how I want to be. I want to be out on my face. I want to be present. And you were telling me that you perceived me as, you know, this other way.
Can I throw something in just that happened last week, and this may be completely wrong. It's just, yeah, I'm trying. I started to try and explain something to Judy, and my habit tends, when I'm not sure that someone's understanding me, I repeat myself in a different way. And I was talking for quite some time without Judy interacting or anything, and I'm wondering if that's something you just have a little discomfort, it makes it a little bit more difficult for you. I'm thinking about the description you've given us of your interactions with your mother, where you just, you know? And so it's maybe just a means of communicating that causes her a problem we can be sensitive to, just allowing that to and fro to free her up from getting, that may be way off.
I remember there was one interaction between you and me where I felt you really reaching out to me. And it felt a very good, warm interaction. And then you went on and started explaining. And for me, a curtain just went down. So, you know, you're completely accurate. And
Well, it might help just to be aware of that.
It helps. It's very astute.